Hello and welcome to Behind the Lines. I'm Diane Dayton. Today we're going to talk about our mental health. With us we have Larry George, Executive Director of Lancaster County Behavioral Health and Developmental Services. Thank you for being with us.
My pleasure. Thank you.
Jennie Rose Huber, you are Community Education Manager, and this is for Behavioral Health at Lancaster Regional Medical Center. Thank you for being here.
Thank you for having me.
Our mental health is so important to talk about, and we need to take care of our mental health because it really does affect everything else. Sometimes it's a little hard to diagnose mental illness because there's so many different types. Is that right?
Indeed there are. And as you say, mental health has so many facets to it. I think the concept in and of itself is somewhat abstract. But it does speak to every aspect of our lives. Mental illness is where our mental health is not operating at a functional or an optimal level. And I think all of us are subject to some degree of mental illness. What we stand for, Behavioral Health Developmental Services, and our partner organizations such as Mental Health America, are about destigmatizing mental illness and incorporating treatment of mental illness into our mental health.
And this is something that can be done, and we're working toward being more effective with it too, right?
I think Lancaster County is an innovative county. There's lots of things going on throughout the county on trying to destigmatize this. The mental health collaboration, where a lot of the mental health providers in the county are working together on how to have easier access for people who are diagnosed, just to get rid of the stigma, to bring awareness to people who may not be suffering, but a loved one may be. So there's a lot of great things going on.
And it is about working together collaboratively, isn't it?
Certainly.
And Mental Health America of Lancaster County is really doing a good job with that too.
I would regard Mental Health America as the unifying organization under which organizations or agencies such as Behavioral Health Developmental Services, Lancaster Regional Medical Center, the other hospitals, the multiple agencies in the county, all come together.
Yeah, there are so many different types of mental illness, and even like you were saying, sometimes we each are touched with a period of depression here
Certainly.
and there. It's when it gets to that point where it's too serious that we really need to take some action, right?
Indeed, and that's a very individualized place. I think what we've tried to do is help people to recognize when their lives are being negatively impacted by, say, depression, anxiety.
Yeah, and to be aware enough to make a change, is that right?
It affects everyone differently. So many people don't realize that. They look for a very rigid, well, they don't fit this, so they're not suffering from that. But it affects everyone completely differently, and you have to know the warning signs. You have to know what to watch for. Little changes can be going on, but it could be a huge underlying factor.
What are some things we should look for? What warning signs are there?
Changes in sleeping habits, changes in eating, changes, they no longer enjoy things that they used to. That's a huge warning sign. With suicide, you could have all different things going on. Someone could become very withdrawn, they could become agitated, they could change from being outgoing to they no longer want to have any social interaction. There's so many different signs for different diagnoses, so it's hard.
Okay. We're going to put your websites up on the screen because there's a lot of valuable information there too. What are we going to find on the website?
You'll find that Lancaster County BHDS serves as essentially a resource center. We help facilitate services for individuals. We are aware of all the services and resources that are available within Lancaster County. And were you to contact Lancaster County BHDS, you would likely be assessed for which of those services might be the best match for you.
Okay. And what will we find with your website?
We have a lot of great informational, educational pieces, links, resources that you can go and find out more. We also have, you can come to the ER, where if you do need immediate assistance, and then within our unit at the Behavioral Health Unit, you can access us and have an evaluation and assessment to see if our services are appropriate for what's going on as well.
Treatments vary so much because individuals' needs vary so much. Can you address any of that? I mean, if there's an issue and somebody wants to find out, how can I get help? They would contact
our agency, yes, and our intake staff and our crisis intervention staff. And I would like to emphasize the 24/7 availability and accessibility of crisis intervention for anyone that is feeling the need to reach out, or anyone who loves one is seemingly needing to reach out, is in distress. We would be able to assess what an individual's needs are and refer them to the proper resource.
So even if you're just thinking there may be an issue, reach out,
Reach
right?
out and talk to someone.
Yeah.
Yes.
Don't let it sit. Reach
No.
out. Be proactive about it,
Either
right?
for yourself or for a loved one.
Exactly.
Yes.
What else would you like to add to that?
I think that's the biggest thing, reaching out, stepping up and realizing that something is going on. Don't be afraid. So many people are afraid because of that stigma, but don't be. There's endless resources out there. We're available 24/7 as well. We have a full evaluation and assessment staff. They're 24/7. You can access them any way you need.
I think mental health has really been in the news lately because of the loss of Robin Williams and other issues that are going on. And I think we need to realize that this is important to talk about, and it is important to be healthy. And there are ways to do it, and there are programs, right?
Yes.
Yeah.
Your mental wellness affects your physical wellness, and so many people don't realize that. If you're not mentally well, you're not going to be physically well. So many people focus on physical illnesses, but your mental health is just as important.
Yes, it definitely is. And you've been doing this for a long time too, right, Larry?
I have. I've been with the county for 25 years. Yes.
Yeah. So you've seen a lot of difference that this organization and organizations like this within the community can really make in keeping our community healthy, right?
Truly, and I think what I'm proudest of is the recognition of agencies such as mine and Mental Health America that we need to educate the public. I think Jennie had mentioned destigmatization earlier, and that's essential to what we do. Taking these issues out of the closet.
That's right. And that's what we're doing today.
Yes.
And we're going to keep talking about it to make a difference in our community. And I really appreciate you coming on today and giving the information and giving us the resources. Once again, the websites we're going to put up on the screen, and there's also hotlines so that you know that you can get help 24/7.
Please.
Thank you so much for all that you do. We're going to talk about other issues, and suicide is one of them. Stay with us. Welcome back to Behind the Lines. We're talking about our mental health. With us right now, we have Jan Baily. And Jan, you are the Executive Director of Mental Health America of Lancaster County. Thank you for being with us. And Mark, and your last name is? Schanzter. And you are the founder of Walk for DES, which is Detect Early Signs. We're talking specifically this time about suicide. And some statistics that I have. 14.2 minutes in the U.S., there's a suicide. Nearly 1 million people attempt each year. In Lancaster County, we have about 40 suicides per year. And that's what happened to your son at 21, right, Mark?
Yes. I lost my son, Desmond, June 6, 2011, to suicide, and we didn't have any warning signs.
And since then, you've started to see and you have learned more about this.
Learned a heck of a lot about suicide and all the warning signs, and I still don't have those signs, but I see those signs with people I come in contact with. And it's actually every 14.2 seconds, not minutes, there is suicide that happens.
Wow.
Yeah, so it's something that we have to kill the stigma about, and something we have to be more vocal about. My whole mission to start was to try to learn how to get inside the mind of someone contemplating suicide. How do we reach that person? How do we reach that person and become inside that person's head so that they want to be saved? You know, there's a lot of help outside the realm to help me and to help others who are suicide survivors. But how do we get to that person before he or she makes that fatal, stupid, last 30-second wrong idea?
What do we need to know, Jan?
I believe that what's most critical is that suicide is not always, but often the end result of untreated depression, of isolation, of feeling disconnected. And what we know is that in 90% of the deaths by suicide, there was a diagnosable and treatable mental illness.
Yeah. And the warning signs that we're talking about, let's talk about these because it's important. Warning signs, some of the ones talking about wanting to kill oneself.
There's a number of warning signs. Some of them are a change in mood, change, as Jennie said previously, in sleeping patterns.
Yeah.
Use of alcohol, excessively. One of the signs is wanting to be by yourself and not to be a part of going out with your friends or your family, and you just want to shut yourself down. Isolation. Another warning sign for someone in my age would be getting their things in order. Like telling your wife, well, I have a list of how to do all this, and this is where the will is, this is where my insurance is, bills go to so-and-so, putting things in order.
Okay. Talking about being a burden to others, engaging in self-harming behaviors or some other things too. Showing rage, talking about seeking revenge, extreme moods, right?
Extreme mood changes, that's correct.
Okay. Feeling hopeless, trapped, unbearable pain.
Yes.
And it's to the extreme with this, but it's looking at this whole composite together, is that right?
It is, and it's, on Facebook there's a lot of different groups, and it's not just us here in Lancaster County, it's all over the country, and I'm involved with a lot of different groups.
Yes.
And you can, if you don't hear it and they're not in front of you, you can hear it in their typing when they're telling you what's going on in their lives. So knowing these warning signs is one thing, but knowing them and be able to send someone where they should go to seek help or take them, that's the bottom line.
And that's where you come in. Tell us more.
I think when in a larger society and a broader context, people are afraid to enter into a conversation about suicide, even though they're observing the signs. And one of the things that we promote is if you're seeing somebody who is not feeling well, who's isolated, who's depressed, and whose actions are such, to enter into that conversation and to ask the question, have you or are you feeling suicidal? Because there's a myth that's out there that suggests that if we say suicide, that person's going to go out and complete suicide.
Okay.
And that doesn't happen. I think what somebody who is experiencing and expressing all the warning signs really would love to have somebody enter their lives and say, hey, are you okay? What do you need? How can we get you to the resources in the community that exist? What help can we provide? I'm there for you. I'm there for you 24/7. I'm not going to let you walk through this alone. And what we also find is that in the survivors that we speak to, those who have thought about suicide, those who have attempted suicide, come back to say, wow, I didn't realize how full my life could be today. And where I was in a place of such depression, such sadness, grief, whatever that might be, that I didn't know how to work myself out. But with the resources that are available in the community, they found help, they found treatment, and are enjoying lives filled with hope, recovery, and possibility.
And that's the key, what you said here. We need to verbalize it. If we see these signs with a friend or someone in our family, we need to address it. Don't be afraid to do it, right?
Absolutely.
Ask them, open the dialogue, open the conversation, bring it out to the open, which is what we're trying to do with the TV show today too. We're going to put once again on the screen the website. You can find out more information to get help, more about warning signs and risk factors and that sort of thing. And thank you so much for the walk that you do and that the awareness that you are bringing as well. We can find out more about that and support you with this. Thank you so much for coming on and sharing your story and all the good work that you do. We're going to take a brief pause. More on mental health. Stay with us. Welcome back to Behind the Lines. We're talking about our mental health. With us right now, we have Mary Woolson. You are a holistic life coach, and you're also founder of Synchronessence. Thank you for being with us.
You.
And Ryan McGinnis, you are a mental health professional. Thank you for being with us.
Thanks for having me.
On the show that we talked about a little bit, the segment a little bit earlier, we're talking about suicide and how it does have a ripple effect. And it affects so many of the family and friends. I admit 6 people, but it's usually even so many more. But there is help out there, and that's why you both do what you do. And you both have had experiences with depression, is that right?
Yes,
Tell me a little bit.
That's correct. Depression has actually been part of my life since I was a teenager, and it's kind of waxed and waned over the years, and sometimes it's come with some situational difficulties in my life. And my most recent bout of depression came a few years ago when I made a move from New York here to Lancaster County. And it really threw me for a loop. And I became clinically depressed and was in a situation where I needed to take a leave of absence from work, and during that time had to figure out how to get the help that I needed to heal. And so I did turn to a variety of professionals, found a psychiatrist who could help me manage my medication. I was able to get counseling, and really just had a chance to sit back and do a lot of soul searching to figure out what I wanted to do next with my life, which I think is a very important part of the healing process. And so that's actually how I came to become a holistic lifestyle coach. I studied that, and now I'm getting much more involved in the mental health community, and I am currently serving as the facilitator for the Women's Depression Support Group that's run by Mental Health America of Lancaster County.
Oh, that's excellent. What's Synchronessence?
Synchronessence is my holistic lifestyle coaching and healing touch energy therapy practice.
Okay.
And so what I do is I primarily do focus on women to help them live happier and healthier lives by teaching them how to eat better, to move more, to connect with their very essence so that they can be the best version of themselves possible.
That's rewarding, isn't it?
Very much so.
Excellent. Ryan, you have a story too.
I do.
Tell us.
I struggled with depression a lot when I was a teenager as well, and suicide ideation. And can remember feeling, I work with Mental Health America for the Men's Depression Group and facilitating that. And so something that was said in our last meeting just on Tuesday was how depression manifests itself where you have no enjoyment in life at all. And one gentleman said how everything was just okay. And I commented about how sometimes okay is worse than being sad, because at least in sadness there's emotion, you feel alive. But with depression, it's just such even keel that I guess this could seem a bit morbid, but at 16 years old, who doesn't think a bit morbidly, that I was hoping that something traumatic would happen in life just so I could feel. That I could feel something, that I could grieve or allow myself to experience grief at 16, because I just felt nothing. I didn't feel alive. And so I think if you talk to most therapists or counselors, you'd find that because of their own struggle, and that they found the resources that were out there, they were lucky enough to find support, that they find it very rewarding to help others.
And that's what you're doing as well.
Correct.
Boy, it makes a big difference in identifying it and reaching out and talking to someone, right?
It sure does, and I think the important thing is to know that you can ask for help, and you need to find the courage to ask for that help, because sometimes with that stigma that we talked about earlier, you feel numb and you feel afraid and you feel isolated, that no one else in the world could possibly be experiencing what you are. And that is just so not true. And so when you can have the courage to ask for the help that you need, you will get it. People are available, and there are lots of trained professionals that can help you through the circumstance. One of the things that I have found so very important is telling my own story, because for so many years I hid the fact that I was depressed and that I had anxiety and that I had issues. And it's really been quite liberating to be able to talk about it and to know that it is inspiring other people to get help.
Yes, and that's what we're doing right now with this too, on a larger scale too. And what we need to know is that reaching out is the first step.
Yeah.
Talking about it, right?
Yeah, absolutely. I commended all of the men who came to our meeting because depression can be so debilitating that even just getting out of bed can be a difficult task. And then you start to feel depressed about being depressed because you feel worthless, and it's just this cycle that takes place. And these men, got out of bed and they came to the meeting, and that's such a huge step. And after an hour and a half of meeting together and hearing that they weren't alone, that what they were experiencing was felt by all the other men that were in the room, and the similarities. They all felt very lonely and isolated. And after the hour and a half of meeting together, you could just see the burden lifted because they could see that other men were struggling and were no longer afraid to talk about it and to get some help.
And by coming out of the isolation, sharing your experience, hearing about others, and connecting, there is an empowerment there, isn't there?
Absolutely.
Yeah, and it gives you the courage and the strength to take the next steps. Would you say that's correct?
It does. It really does. Because I think, yes, people just need to know that they're not alone. And depression manifests itself in a whole variety of different ways. And for me, sitting around the table with other women who understand my story, and I understand theirs, we know what it feels like to walk in each other's shoes, is just such an important aspect of any kind of support group.
Yeah, it really is. I'm really glad what the two of you are doing, and that you've taken your own experiences, and what you're doing is that you are sharing them with us so that we all can learn and we all can connect and not be afraid to talk about it.
Right.
Because in doing this and coming on the show today, that's exactly what you're doing. You're putting it out there, and you are helping so many people for what you're doing today. I really appreciate you being here. We're going to put the websites up on the screen. There's also hotlines that are 24/7 that people can get additional information. Let's continue to talk about this. Let's keep the dialogue going. Our mental health is so important, and you are too. Thank you for being here today. I'd like to say thank you for joining us today. We hope that you've learned something today. And I'm Diane Dayton with Behind the Lines. Thanks for joining us, and remember, keep looking behind the lines. You might be surprised what you find.